I'm always kind of doing things that I know are kind of at the edge of my ability, to be honest with you. But I know this is the only shot this person has. If I think, okay, I've got a better chance of having a good outcome than a bad outcome, let me take a chance, let me go for it.
Tom Catena, I call him the Albert Schweitzer of Sudan. He's living and working in war-torn Sudan, saving lives every day. He's a miracle worker, a great missionary, a great physician, and it's an honor to know him. Dr. Catena, talk to me about what you're doing in Sudan and why you went there and how you're doing there.
Well, I'm a missionary doctor in Sudan, and specifically the Nuba Mountains of Sudan, which is the southern part of the Sudanese Republic. I've been there for 17 years. Before that, I was working in Kenya.
Why have you stayed?
Well, I think it's the kind of thing where you see the tremendous need there. There are very few health professionals anywhere in the mountains. And, there's a bank robber named Willie Sutton. And people asked him, Willie, why do you rob banks? And he said, well, because that's where the money is. So for me as a doctor, you too, Mark, you see how it is. I said, well, that's where the sick people are. That's where the greatest need is. So we're a 485-bed teaching and referral hospital. We're the sole referral hospital now for about 3 million people. If you're going from the US, it'll take you 5 days a week to get there. One of the guys that took 3 days to travel from the refugee camp, Ida refugee camp in north of Sudan, to our hospital, 120 miles. Took him 3 days.
I have a theory that miracles are more likely to occur in places like that are really remote, or maybe they're more likely to be seen. Have you noticed that, and how often do you see a miracle?
Well, I think the fact that we're able to even function in that environment is the first miracle. Logistical problems are incredible, but there's civil war going on, and now the dry season's coming up. It's the fighting season for us in Nuba, so it's pretty dangerous. It's pretty dangerous. So you see tremendous highs and tremendous miracles almost every day. Consequently, you also get tremendous lows and disappointments.
What is a miracle, too? What do you think a miracle is?
I mean, a miracle is something you can't explain. Somebody comes in, they present with a certain problem, and you feel there's no way that we can fix this. It's out of my realm of possibility. And then, being the only one that can possibly do something about it, we take a chance, we trust in Providence, we do the operation, and they get a good outcome. I think that for me is enough. That's a miracle.
Is God's presence found in that?
Very much. I think very much.
Talk to me about this little girl. What's her name? How did she come to you? Then tell me what the miracle is.
So this patient's name is Rita, and she came to us, this was some years ago.
How old?
She was about 3 years old then. She had a very large flank mass, huge left tumor in the left kidney. The right kidney had a tumor in the lower pole. I'd never done a case where he did a nephrectomy on one side, total nephrectomy, then a partial on the other side. And I was really afraid of doing it.
Why?
Because I'd never done it before. And I said, okay, I can take out one kidney, I can kind of make it through that, but that leaves the other kidney as a backup. Now, if I take out one kidney and muff the other kidney, screw it up, and that kidney goes, the patient's gonna die. We don't have dialysis, we can't do kidney transplants. It's the end of the line for that patient. So, kind of took the leap of faith. There was a visiting doctor with me, my good friend Corey was with me. And Corey said, well, let's check on YouTube if they have a video about this. And one of the many miracles of this case is that we had internet. It was very slow and very poor. So poor that I'd never seen a YouTube video, I never heard of YouTube. And up to that point, usually the speed was so slow that you couldn't download the video. It was terrible. It was really, really bad. I mean, you couldn't, to send an email would be like 20 minutes. The thing would be going around and around. You couldn't download videos. I'd give you 3 bars, but it would just take forever. You would say I was trying to download a document somebody sent me, or download a picture, or send a picture. It would just go in circles, circles. You'd be there for half an hour, and then it would just time out. It would quit. You could not watch videos. It was too slow. For some reason, he found it on the internet. He found a group of Polish surgeons demonstrating how to do a partial nephrectomy He was able to download it.
You speak Polish?
No, I don't, but I could watch what they were doing, just kind of watching their technique. And we could download it, we could just see what the technique, how they were doing it. I said, okay, I think we can pull it off. Yeah, so it really, it's no kidding, it was a miracle that we were able to watch that video. I can't explain it, to be honest with you, I can't. I just was there and it just worked, I don't know. I cannot explain it. And after that, it never worked again. I never saw another video. So after we saw it, I thought, okay, we saw the video, I thought, okay, I think we can do this. I think it's doable. Let's give it a shot. Because, the reality is there was nowhere to send her. It's not like, it's not like you're in Alaska or in Nebraska. You can send them somewhere, right? To the north was Sudan, right? There's no way to send them to Khartoum. We were in civil war. The south was impossible. And where do you send them to? Juba in South Sudan? They can't do that surgery there. They can't. So when I saw the download complete, my emotion was one of relief. Because I thought, okay, with this video, I think she has a chance. That's all I want, is a chance to make this person better. We just kind of followed those.
Did you have the equipment in the video?
Actually, we didn't, no, because we didn't have any of those fancy clamps. We didn't have the cold slush to kind of freeze the kidney. So we just kind of had to wing it a bit.
But you have to stop the blood flow to the kidney. What'd you do to stop the flow with the renal artery? You had to do something.
Nothing. We just cut through. We just cut through the kidney. We were able to cauterize what we could.
How did you know where to stop cutting? From the video?
Yeah, from the video. The video was incredibly helpful. Just from watching that, I had an idea. Okay, I think this is how we have to proceed with this case.
One more question about this case is the anesthesia you use. Do you do your own anesthesia?
We do. I do my own anesthesia. So we have a small little device. It's called an OMV. It looks like a little espresso thing. Those Biletto things. And we do all of our general anesthetic with that. Very simple.
So she gets this anesthesia. She does well. You go through the chemo, and then you send her home. And then when was the follow-up?
After that point, I didn't see her again. I heard about I think it was 2 or 3 years after that, one of our staff saw her. She lived in an area pretty far away from our hospital. And they were living in a cave because their area is under assault from the Khartoum Sudan government. Their town was being shelled. So they took refuge in a cave. So one of our staff members was up in that area. He saw her and said she was doing fine.
That's an amazing story. You pray for your patients?
I do.
What do you pray for?
I pray for guidance. I pray for that God will enlighten my brain. He'll guide my hands during the surgery, that I can use good judgment, that I can know when to call it quits and when to proceed on. So I take great comfort in that.
Does it work?
I think so. I'm a strong believer in the power of prayer. Also, I know we have a lot of people, we have an army of people in the U.S. praying for us every day. And I think that's how we are able to continue on, despite all the chaos going on around us, all the civil war, all the problems, all this hunger, whatever problems are there, we're able to continue with the work and keep going ahead. The biggest way to help is to give money. If I can be very blunt and direct, think of us as being at the end of the world. So to get stuff out there is really, really difficult and very expensive. There's a very simple website, healthfornuba.com.
Do you believe that if you put out a lot of kindness and good deeds in the world, that God will reward you?
I would say, well, the short answer I would say is yes. Although God is funny because you can do that and you can still get problems, right? So it's not a formula. It's like, well, if I do this many good deeds, I'll get this reward in this life. Our view is more, we know what we're supposed to do. Doing good deeds, being kind, serving the poor, all these things are good. And this is our duty in this life. The reward might not come in this life. We know our reward is eternal. That after we die, we've got a place in heaven.
What's the current war situation there?
Well, Sudan is a country of war, right? Civil war, specifically. The situation now is terrible. Civil war all over the country. There are, in Nuba Mountains alone, there are 1 million displaced people. And, the civil war is very active. There's no efforts at peace negotiations now. I don't see any clear pathway for peace. It's going to continue on.
Okay, but most of the patients you're treating are displaced. They're
Right.
refugees.
Right.
You afraid for your own safety?
Not too much. God is with me, so whatever happens, happens. I'm resigned to that fact, and I'm there to help. So
You're great.
thanks, Mark.